Good afternoon, everyone.
Good afternoon.
What a glorious and beautiful summer day this is.
Absolutely.
An occasion for celebration.
Yeah.
Pardon that it's a little warm, but we're happy about that. My name is Michael Taylor, and I am the Chief Executive Officer of the Cornell Scott-Hill Health Center. On behalf of our board and staff, some of whom are here today, so everyone, those who are board members and staff, please wait so everyone can identify you. I want to welcome you to a very happy occasion. The celebration of the development of a new care site here at Wilmot Crossing. We are thrilled about this opportunity and the opportunity it brings us as an organization to improve healthcare access for the residents of the Wilmot community and nearby New Haven and Camden communities. Is there anyone here who is not familiar with the Cornell Scott-Hill Health Center? Well, since we're in somewhat of a new spot, we'll give a little thumbnail sketch. For those of you who might not know, Cornell Scott-Hill Health Center is an organization that was established in 1968 by our namesakes, Cornell Scott, and other community members and representatives of Yale University. We have grown considerably and evolved over the years since 1968 to become one of the most progressive and highly regarded community health center in this nation. Today, we are one of the largest health centers in the state of Connecticut and operate 20 care sites, soon to be 21, in Greater New Haven. Our service complement includes primary medical, behavioral health, and dental. And our clinical chiefs are here with us today. I must say, they are brilliant. In addition to that, we offer a host of specialty and subspecialty services, including women's health, cardiology, gastroenterology, podiatry, ophthalmology, ENT, orthopedics, and more. We are also quite blessed to have a very vibrant and active wellness department that helps our patient population address chronic diseases and allows them to live in grace. At this location, we'll offer primary medical, behavioral health, and dental services, and we will rotate specialty services through this location as demanded by our patient population. Our mission is to measurably improve the health and wellness and well-being of the communities we serve by providing excellent and compassionate care that is accessible to all. We employ more than 500 people, all of whom have huge hearts. So this location, we are thrilled that it is becoming a part of the Cornell Scott-Hill Health Center family, and we get to adopt the residents of this community. We are thrilled by that prospect. Let me tell you that this was no easy doing. We've been working on this for 5 years, since the reconstruction of the Wilmot Crossing community began. We have kept the faith. We have been absolutely determined that we would make a care site a reality here at Wilmot Crossing. And it is representative of the passion that we feel for caring for others. There are many, many, many thank yous associated with this day. The first of which is an acknowledgement to the Health Resources and Services Administration, which enabled the grant funds that will allow us to develop this space. We certainly thank our Board of Directors for setting and staying the course that brought us to this celebration. I also want to say thank you to Mayor Hart for your leadership, support, caring spirit, and encouragement. Thank you to Karen DuBois Walton for partnering with us to make this possible in Elm City communities. A special thank you to Ms. Sheila Allen Bell, as it is she who first conceived the development of this care site in this community. And as well, I want to acknowledge a thank you to the residents of both the Wilmot Crossing and the nearby communities. It is our pleasure and our honor to serve you, and we do care to keep you all well. With that, it is my great pleasure to introduce Angel Rivero, our board chair, and Miss Mabel Carroll, who is one of the residents of this building.
And I am going to defer to the secretary of our corporation because I was raised by a mom who was very smart.
Good afternoon, ladies and gentlemen. This is a great day. I am so excited. I am so happy. We have looked for this for a long time. We have clinics going to be in our community, but we don't have to go so far out. A lot of people don't have transportation, but this is a great day. I'm a resident here. I love it here. And we will do everything that we can to make sure our resident and the neighborhood does what it is supposed to do. Thank you very much.
Just two quick things. There's a lot in common between Wilmot Crossing and this new center that we've put together. And that is, and really, please don't underestimate this, it really does take support from a broad constituency, from a broad group of people, maybe people that don't always work together. Those of you who work at Elm City Communities know how hard it is to do the bureaucratic lifting and then to get support behind it from the community when there are always people who are suspicious about the new stuff, people who are just worried about change. And the same with us. Right now the healthcare field is changing dramatically. We're going to need your help. I can guarantee you the board's going to be behind this, but there will be times where we're going to need your help, and we're going to need your help to make a change so that's accountable to you and so that we're really doing the best job that we can. So please remember that. Enjoy it, live great lives, great healthy lives, but be there as well to help us. Thank you.
And with that, it is my great pleasure to introduce Mayor Tony N. Hart, who is the mayor of the city of New Haven and a dear old friend and colleague.
Thank you. Thank you very much. It really is an honor and a privilege to be here this afternoon to recognize the growth of a place that I spent 27 years of my life and actually worked for Michael, the board, Ms. Carroll, and everyone. And I've got to tell you that Cornell Scott was onto something a long time ago when he realized that healthcare really had to be in the community. And I know that we have, as someone who really supports everything that we do, Rosa DeLauro, our congresswoman, who makes sure that we get the resources that we need. Can we give her a round of applause? Gary Winfield, our state senator, who makes sure and watches over what, in many respects, was a bit of a train wreck this year. But he's someone who is really important to the overall healthcare delivery system and the work that they do up at the General Assembly. Karen DeBose Walton is fantastic, has been working on this for as long as you have, I'm sure. And you know what, it's really interesting to me that we often don't think about what it takes to actually collaborate on projects. And so when Angel was talking about everyone working together and collaborating, it's an easy word to say, and oftentimes it's very hard to do. So I congratulate you for sticking to it for 5 years. I especially congratulate Michael Taylor for the work that he does at the Cornell Scott Hill Health Center and all of the people there. I know about that work. I know that there are people alive today and well because of the commitment and the work that is done at Cornell Scott Hill Health Center across this region. I commend you for your successful grant application and I congratulate you on the start of this very exciting project. It's no secret in the healthcare industry and among those who make public policy, the first obstacle to be overcome in terms of improved health outcomes is improving the connection between the patient and the provider. Simply put, physical proximity to care lends itself to better physical health care. And when you think about how isolated this place can be if you don't have a car and you can't get around, it's really important that people can actually walk to their health care center. No one understands this better than my former colleagues at the Cornell Scott Hill Health Center. And we're so pleased that with clinics citywide already, it has the foresight to build and open another one right here. On this site, as you heard, there will be primary care, mental health and substance abuse assessment and treatment, and some specialty care as well. The Health Care Center will also bring dental services to this community. Cornell Scott Hill Health Center understood before anybody did that the mouth is connected to the body. And oftentimes you see insurance companies don't pay for dental care. You see that it's really tough to get Medicaid to pay adequately for dental care, but they were ahead of the game. But the most important thing to me, given where we are today, is their commitment to mental health and behavioral health care. In the wake of so much tragic news about what some who've had mental illness and have attacked others with guns, and to addicts in our town who unknowingly took lethal amounts of poison street drugs. No further evidence is available to me for us to understand how urgent the need is to provide mental health and substance abuse services and make them more widely available. So it's really wonderful that it is happening here. We need it. Thank you. We're so grateful to Cornell Scott Hill Health Center for expanding to Wilmot Road, and we're grateful for the Housing Authority as well for their partnership, for hosting this clinic. We're also grateful for Rosa DeLauro and the federal government for the financial wherewithal to bring this project together. It does take a village, it does take collaboration, and with that we will have greater community health. Thank you so much.
Thank you, Mayor Park. This next lady really needs no introduction. She is the embodiment of warmth and caring about even those who she doesn't know. And we are quite honored to have her with us today and to have her represent us at the federal government. Thank you, Rosa, for making this possible.
Well, I'm very excited to be here today and just give you tell you why. For some of the younger people here, I'm so old that I can go way back and tell you, you know, when you come through here to see what has been done by the residents, by the board, and what's being done now with the Housing Authority and with the Hill Health Center. It's a transformation of a community that for so long, as the mayor pointed out, has felt isolated from the rest of the city of New Haven. And I had the honor and pleasure of working with city government so many years ago with Mayor Logue, and this is really a dream come true here today. And so I also want to say that the mayor spoke about Cornell Scott. Well, Scotty was, my God, he really transformed people's lives. The most quiet, unassuming, spine of steel person you would ever meet. And you know, that tenacity that he really showed every day in wanting to make sure that everyone had access to good health care. And that is what the splendor of today is all about. You know, I was with the mayor earlier, and it was about a children's program, Read to Grow, but an extension of the Read to Grow program for children, with providing books now to every newborn. And I said this morning that, you know, at her core, it is about her caring about what happens to our kids, whether it's their education, whether it's their health, whether it's their housing. And her passion has been health care, and she's demonstrated both when she was in the Senate and what she did in her professional life with health care. And I would add one more piece to that, is that she understands that the strength of this great city is about the strength of its neighborhoods, and that each one of them needs to be able to succeed and to be viable. And that's why her commitment here is so strong. To State Senator Gary Winfield, to Karen, and it is a collaborative effort. It is a housing authority, it is the state government, it is private efforts in making this all a reality. For over 45 years, the health center has been a leading provider of community health care. So with this grant, to be able to expand to New Haven families, and it's a good day. Not just because of the weather, it's a good day for New Haven, and it's a good day for Connecticut. And the Hill Health Center, the Cornell Scott Hill Health Center, is the oldest community health center in our state. One of the largest. It provides care throughout the Naugatuck Valley, the greater New Haven area, including critical integrated medical and behavioral health solutions. It's a $1 million grant. It will build this site here, we'll build it out, and it will be a bustling place because 23 million people in this country avail themselves of health care through community health care centers. So we know it will be busy, and that how worthwhile that is, and oftentimes it's the only place that people can get health care. That is where they go, to the community health care centers. Primary health care, mental health, as the mayor pointed out, substance abuse assessment, treatment, specialty care for almost 6,000 new patients who live in Northwest New Haven. Dental services, it's one of 290 centers to share $260 million in funding that was originally authorized by the Affordable Care Act and extended in the Medicare Access and the CHIP Reauthorization Act. You know, some people say, well, what was the Affordable Care Act all about? Well, you know, this is a result of the determination and focus of the Affordable Care Act. Listen, I had the opportunity to support this, for which I was so gratified. And that's the opportunity that my job offers, is to say, okay, and full faith and support, because the center is uniquely equipped to fill the gap in healthcare that exists in the West Rock neighborhood. And the Cornell Scott and the Hill Centers, there's no more deserving entity for this award than this group. It's an example, really, of what government, community health centers can do by working together. It will make an impact in the lives of our children and our families, and that can't be overstated in what that means to everyone here today. It's a victory. It's a victory for the board. Mabel, you couldn't have said it better. Thank you, on Hill, where you are, wherever you are. Thank you for that. You know, it's about fighting for the increase in funding that we need to have in order to bring these programs to a place where they succeed. And I will just tell you that the community health center funding, in an environment where you don't get too much bipartisan cooperation, the community health centers do have bipartisan support in the Congress, and we need to keep on so that, in fact, we can do more of it. So I'm so proud to have been able to support this program, and more proud to be here with all of you today to see the fruition. Thank you very, very much.
Thank you, Congressman DeLauro. Now I really have the pleasure of introducing Senator Gary Winfield. We're so pleased that you're here today to join us and help us celebrate. Senator Gary Winfield. afternoon. So I looked around and I realized that I was surrounded by, no offense to the men, but a bunch of phenomenal women who helped to make us get to this place that we are. The mayor, Tony Harp, Mr. Bart Walton, Sheila, who had a lot to do with this, Rosa DeLauro, a bunch of phenomenal women. So what I know about being surrounded by phenomenal women is I'm not going to say too much because they're going to say a bunch of things that we need to say. I'll say this is a good day, not just because of the weather, like Rosa said, but it's the perfect time for this to happen. You know, when I was in the Senate, I watched Tony, when I was in the House rather, I watched Tony be a great advocate for health care. And it's an awesome day that we have the good weather and that she is the mayor when this happens. I think that's a phenomenal thing. Absolutely. And I also know what Rosa said to be true, that, you know, we can talk about access to health care, but if people can't get to the health care, then they don't really have access, even if the health care is in a place where we think is proximate to where they are. So this is a beautiful day. This is the right place with the right mayor. And I'm happy to be able to stand here as someone who is supportive and who gets to stand in the background and watch those phenomenal women push us forward. So thank you.
Thank you. Thank you.
So now I get to introduce my very steadfast partner, Karen DuBois Walton, in bringing this to fruition. This could not have been possible without Karen's support and cooperation and partnership and stick-to-itiveness, because it took us a while to get here. Karen DuBois Walton.
Thank you. This is a great day, and it is wonderful to be able to be here at this point. You know, we changed our name from the Housing Authority of the City of New Haven to Elm City Communities in a very intentional way. And it's because we feel like we're about building communities, not just housing for people. And this was a community that had served its time and needed a rebuild. And we took that on, listening first and foremost to the voices of our residents, what it was that our residents needed in order to have a community. And that's why this building was built here as a gateway to the community. And it's also why we fought for things like opening the road access into Hamden, because that created community. And it's reasons why we've worked with DOT, with Connecticut Transit DOT on bus routes in this neighborhood, because it's about building community. And in listening to our residents, it was about hearing what services they needed in this community. And so I am really thrilled because the original vision, which is by two now retired employees of the Housing Authority, but our former Deputy Executive Director Jimmy Miller and our Assistant Executive Director of Community and Economic Development, Sheila Allen Bell, were the two who thought of this and worked on it, and then it is Sheila who continued through the first round of grant application and then to continue to work with Cornell Scott Hill Health Center around pursuing it and making it a reality. So again, this all comes together because of a team. I want to certainly acknowledge the team that has spoken here today. We would not be here without the federal support of our congressional delegation, without the state support of our state delegation, certainly without our mayor and our local support. This would not have happened without the diligence of Michael and his team moving forward. It is done on behalf of residents like Ms. Mabel and all of you that are gathered here today. I want to acknowledge the Elm City community staff. If you're out there, just wave your hand so everybody can see who worked so hard on this project. And this today, this is the, you know, in the home improvement shows, there's always the, you know, pre, and then there's the big reveal. So this is the before, and this is a really exciting time to be here for the before. We have 9,000 square feet of commercial space in it. There will be things that the community wanted. There will be a food mart at the end. There will be the Hill Health Center, so important for us, and additional things to come as well. And so this is the before. You can have an opportunity to actually come in and tour and see what it looks like, but we absolutely invite you to come back when it's time for the after, for the big reveal, for the ribbon cutting. So thank you all so much. Michael, that phone call on that particular day, I will always remember it with the announcement that you got the grant, and that's so important. So please, thank you. Join us for snacks and food. And I'm being signaled to say something else. I don't know.
Move the mic. Just move the mic. There you go.
Can't hear me? Do I have to say all that again? No. Thank you all.
Thank you all for joining us on this wonderful day and great occasion. Please feel free to help yourself to snacks and goodie bags, I understand we have also, and take a tour of our new facility. Come back and see us when we're open, quickly and often. Thank you.
Thank you.